13. Most popular dog breeds and their health issues. 1. Bulldog. Respiratory problems. Like all dogs with those adorable smashed-in faces, bulldogs can suffer from breathing problems. Your bulldog's small nostrils, elongated soft palate, and narrow trachea are the reasons why he probably snores, and they can lead to a life-threatening emergency if he gets overheated or overtired. That's why it's important to keep bulldogs cool in the summer and never overdo it with exercise. 2. Pug. Eye problems. With their squashed faces and bulgy eyes, pugs are at risk for eye problems. The most serious is an eye popping out of its socket. This can happen if a pug gets into an accident or a fight with another dog. If this happens, cover the eye with a damp cloth and rush your dog to the vet. The vet may be able to put the eye back in place, although whether the dog will retain vision in the eye depends on the severity of the damage. 3. German Shepherd. Hip dysplasia. Many large breeds are prone to hip dysplasia. In hip dysplasia, the joints ball and socket don't fit together properly, which causes pain, arthritis, and problems walking. When looking for a German Shepherd puppy, ask the breeder whether the parents have been screened for hip dysplasia. Parents with healthy hips are more likely to produce puppies with healthy hips. 4. Labrador Retriever. Obesity. Any dog can become overweight, but labs are especially prone to it. And just like with people, obesity is linked to health problems in dogs. Labs need vigorous daily exercise. If your lab is constantly begging for more food, try giving her raw carrots, green beans, or apples to snack on. Since prevention is easier than weight loss, it's best to consult with your vet on a diet plan that's right for your pet. 5. Beagle. Epilepsy. Epilepsy, a brain disorder that causes seizures, seems to be more common in beagles than in other dog breeds. Epileptic dogs will usually have their first seizure between 6 months and 3 years old. Though epilepsy can't be cured, frequent seizures, more than one a month, can usually be managed with anti-seizure medication. 6. Shih Tzu. Wobbly kneecaps. Wobbly kneecaps, or patellar luxation, are extremely common in toy breeds like Shih Tzus. In patellar luxation, the kneecap occasionally pops out of place, causing the dog to hobble, skip a step, or limp. The kneecap will usually pop back into position on its own, but in severe cases, surgery may be necessary to correct the problem and prevent arthritis. 7. Boxer. Cancer. Boxers are at higher risk for certain types of cancer, including lymphoma and mast cell tumors. Lymphoma is cancer of the lymph nodes and involves white blood cells known as lymphocytes. Mast cell tumors are a type of skin cancer that can have varied forms and also involve internal organs. In both cases, the cancer is often felt as an unusual lump or bump on your dog's body. Both of these cancers might be treatable, but it's important to catch them early. So if you have a boxer, be sure to check him regularly for lumps. 8. Dachshund. Back problems. Because of their long bodies, dachshunds are at higher risk for back injuries and spinal disc problems. The best way to keep your dachshund feeling her best is to keep her at a healthy weight. Excess weight puts strain on the back. Also try to limit stair climbing and jumping down from furniture, as it can also put stress on the back. 9. Golden Retriever. Skin allergies. Does it seem like your golden is constantly licking? Unlike people, dogs usually don't sneeze when they're allergic to something. Instead, they tend to get itchy skin. And frequent licking, scratching, and chewing can lead to hot spots, red, oozing sores. Before starting any long-term treatment at home, be sure to consult with your vet first about your dog's condition and needs. To soothe itchy skin, give your dog baths with oatmeal shampoo, add an omega-3 supplement to his diet, and make sure he has regular flea treatment. 10. Rottweiler. Joint problems. Large breeds like the Rottweiler are at risk for a variety of joint problems, including hip dysplasia, elbow dysplasia, arthritis, and osteochondrosis dissecans (OCD). OCD is a condition that develops in large, fast-growing puppies in which the cartilage in a joint doesn't form properly. Feeding the right amount of a balanced diet may help keep your Rottweiler's joints healthy. However, many dogs require surgery to remove the abnormal cartilage. 11. Pomeranian. Hair loss. Pomeranians are predisposed to an adrenal gland disease called alopecia X, which causes hair loss. Alopecia X usually begins when a dog is young. If a dog with alopecia X is intact, spaying or neutering often causes the hair to grow back. The hair loss is caused by excess production of sex hormones. Melatonin supplements can also help. 12. Chihuahua. Collapsing trachea. Does your Chihuahua make a honking noise when she gets excited? She may have a collapsing trachea, a common problem in toy breeds. With collapsing trachea, the cartilage that normally holds the trachea open is weak, so the trachea flattens. Some dogs go their whole lives with collapsing trachea and have no problems from it, others require medication. In severe cases, surgery may be necessary to prop the trachea open. 13. Doberman Pinscher. Heart condition. Dilated cardiomyopathy (DCM) is a serious heart condition in which the heart's chambers are stretched out and don't pump blood effectively. Often, owners of dogs with DCM don't even realize something is wrong until their dog collapses. Because DCM is so common in Dobermans, many vets suggest annual screenings. Medications can regulate heart rhythm and improve the heart's ability to pump, but there is no cure for DCM.